In this video, we'll be having a look at 3 different telltale signs on how gluten is damaging your health. You might have heard of a gluten-free diet and why a lot of individuals are actively trying to remove gluten from their diet. But in case you don't know what gluten is, it's a protein normally found in barley, wheat and malt. For some people, it can be quite a pain to digest. Among them are those with celiac disease. Celiac is actually the same as celiac, just different spelling. Some people choose to spell it without the O, but the correct spelling is celiac, C-O-E-L-I-A-C. Just thought it was best to mention that to avoid any confusion. Celiac is an autoimmune disorder which badly and permanently damages the nutrient-absorbing structures found in the small intestine. As time passes, gluten consumption destroys the ability of the body to absorb nutrients. Since there is no known cure for celiac disease yet, people who are afflicted with the condition are actively eliminating all gluten and following a gluten-free diet. However, people with celiac disease aren't the only ones who are badly affected by the consumption of gluten. There's another group too, and they're the ones who have gluten intolerance, likewise known as non-celiac gluten sensitivity. If you belong to either of the two, then gluten can be really bad and damaging for you. We created this video to help you figure out why gluten consumption can be bad for you, especially if you're gluten intolerant or a celiac patient. We'll be having a look at 3 different telltale signs on how gluten is currently damaging your health. Why gluten intake is bad for you. There are in fact quite a number of conditions caused by eating gluten. These range from fatigue to inflammatory bowel diseases, even osteoporosis, all by simply eating this protein. Gluten also causes inflammation, which in turn can affect your entire body. Simply put, gluten can have an adverse effect on your brain in the same way that it affects your digestive system and joints. Most people who suffer from inflammations due to gluten intake tend to focus on treating the condition at the surface level. They do so by taking medications which help reduce the symptoms. Unfortunately, they have to do it regularly as they weren't able to get to the root of the problem. If you have a chronic health issue, or even if you don't, you want to eliminate gluten from your diet. After all, gluten is associated with some of the most problematic conditions such as digestive issues and poor brain function. In the event you already consume gluten, here are 3 telltale signs to let you know that it's time to stop. Telltale sign number 1, digestive issues. Occasionally suffering from constipation, diarrhea and other digestive issues might seem normal. However, if either of them happens too often, it could be a sign that gluten is starting to wreck your body. Not surprisingly, this is also a common symptom experienced by gluten-intolerant individuals and those with celiac disease. In some cases, they may even have a particularly pale and unpleasant bowel, mainly because the condition prevents the body from absorbing nutrients properly. According to research, gluten consumption causes digestive issues by disrupting the barriers of the intestine, thus allowing harmful substances to move through towards the bloodstream. Around 14% of Americans suffer from the so-called IBS, irritable bowel syndrome, which causes all sorts of digestive issues. The consumption of gluten makes the symptom even worse than before, and in some cases it may even be the cause of IBS. Around 50% of intolerant individuals suffer from diarrhea on a regular basis, while around 25% of them suffer from constipation. While this is common to gluten-intolerant and celiac-afflicted individuals, those who have been consuming foods with gluten can also be negatively affected. If you begin to experience such symptoms, you might want to stop the consumption of foods containing gluten as soon as possible. If left unattended, it may lead to some serious issues such as dehydration, fatigue, and the loss of electrolytes in the body. How exactly does this happen? Upon eating food containing gluten, the food moves through your stomach, then into the small intestine. From there, the gluten is broken down into gliadin with the help of an enzyme known as transglutaminase, TTG for short. This is commonly called meat glue. Once broken down, it then moves through your digestive system. From there, your digestive system, with the help of a gut-associated lymphoid tissue, will review it for any potential harm it may cause to your body. If you're not gluten intolerant, it will be directly absorbed by your body naturally. However, if you're sensitive to gluten, the protein will be considered as a dangerous substance and your digestive system will produce antibodies to attack it. The problem is that they also attack the TTG, meat glue, as well, thereby causing the microvilli in your intestine to become damaged. What is microvilli, I hear you ask? Here is a quick description for you. Microvilli are most often found in the small intestine. They work in conjunction with villi to absorb more nutrients and more material because they expand the surface area of the intestine. Over time, the microvilli will start breaking down, tearing up the walls of your intestine and letting food particles and other harmful substances move into your bloodstream. If this happens, you'll start experiencing digestive issues such as constipation, bloating, diarrhea, and even malnutrition. Telltale sign number 2, skin problems. Intolerance to gluten doesn't just affect your digestive tract, it also affects your skin as well. If you're starting to experience skin conditions which you never had before, it might be because gluten is starting to take its toll on your body. According to research, 7 out of 10 celiac afflicted individuals experience symptoms on their skin. There's actually a variety of them, but the most common, which is linked to gluten, is dermatitis herpetiformis. Dermatitis herpetiformis is a gluten-caused skin condition in which you experience one of the nastiest, itchiest rashes you could ever have. It's a really painful rash which is often found in 15 to 25% of individuals who have celiac disease. If you have this symptom, you'll notice lesions which appear on any part of your body, mostly in the knees, elbows and buttocks. Fortunately, this only happens to individuals who have a diagnosed or undiagnosed celiac disease. Another common symptom is a very dry and flaky skin. Although it's still not clear whether the consumption of gluten directly causes dry skin. Some physicians believe that poor nutrient absorption caused by celiac disease can steal the nutrients which your skin is supposed to have, thereby leading to a very dry skin. In some cases, this can be remedied by resorting to a gluten-free diet. Lastly, there's a psoriasis, a skin condition which causes your skin to develop red and scaly plaques. According to several studies, regular gluten consumption is strongly linked to the development of this condition. Those who are diagnosed with psoriasis have a huge amounts of antibodies in their bloodstreams, which only suggests that their bodies are reacting to the gluten in their diet regardless if they're diagnosed with celiac disease or not. While it's not yet clear whether gluten is directly causing psoriasis or not, there are some reports that show people who followed a gluten-free diet were able to experience a significant improvement in their skin symptoms even if they don't have celiac disease. Telltale sign number 3. Recurring migraines. A lot of people suffer from a headache or migraine every once in a while. In fact, it's a common condition which affects around 10 to 12% of the Western population. However, if migraine appears too often, it can be a cause for concern, especially if you're gluten intolerant. Interestingly, a number of studies reveal that those with gluten intolerance are more prone to migraines compared to others. If you have migraines that occur regularly without any clear cause, it might be because you're sensitive to gluten. You might wonder, what is the connection between gluten and migraine? For some people, gluten could trigger migraine. There have been a number of studies that confirm the connection between celiac disease and migraine. A recurring migraine can be an early indication of celiac disease, and those suffering from celiac disease are more likely to experience recurring migraines. According to researchers, the connection between celiac disease and migraine is due to the increased gut permeability and inflammation. As your gut starts leaking inflammatory compounds towards the bloodstream, they can easily find their way into the brain, thereby causing migraine. The connection is so strong that some researchers even recommend that individuals who suffer from recurring migraines should consult with their doctors to check the possibility of celiac disease. Surprisingly, this connection isn't just exclusive to celiac disease. It's also found in individuals who have intestinal disorders such as the IBS. There are only a few studies conducted to address this issue. Fortunately, they did find that having a gluten-free diet can significantly reduce or even eliminate the occurrence of migraine. Although they are still in their preliminary phase, it seems that the results of a gluten-free diet showed a massive decline in both the duration and intensity of migraines. Further research is still required to confirm, but the results suggest that having a gluten-free diet can be a major help to relieve migraines and headaches without relying on expensive medications. I do hope you found this video both helpful and informative, and helped to give you a greater understanding of how gluten is damaging your health. Thank you for watching.